Good afternoon, everybody. My name's Dr. Tariq Kapasia, and this is a CCG webinar hosted by Willows Health on diarrhea and vomiting. So this is the third part of our child health series, and we've been told by parents and guardians that this series has been quite useful in the information that we're giving to our parents and guardians. So that's really good to hear. So just a little bit of recap as to what we've covered in the webinar series so far. During the first webinar in December, we talked about childhood fever and how we manage childhood fever. In the webinar in January, we talked about coughs, colds, wheezes, and the conditions which cause these symptoms. And during these webinars, we really reflected that many of these illnesses are a normal part of childhood illness, and they don't actually denote anything serious necessarily that requires a trip to the GP or A&E department. Now, today we're going to be talking about diarrhea and vomiting. And there's only so much that we can talk about diarrhea and vomiting, but it's such a significant illness in younger children. I think it's worthwhile exploring this from the perspective of our panel. And today on our panel, we've got Dr. Hannah Robbins, who's a senior GP in Leicester, and she is also the lead for children's and young people on the LLR CCGs. And we also have Professor Damien Rowland, who is head of the Children's Emergency Department at the Leicester Royal Infirmary. And we're going to talk about diarrhea and vomiting, the symptoms, how we treat diarrhea and vomiting, what we expect through the course of an illness, and when you ought to be really thinking about seeking medical advice. Despite all that we're going to talk about, it's really important to note that this webinar doesn't replace individual medical advice. It's here to help you make better decisions about what to do if your child becomes unwell. So if you're concerned about your child, it's really important that you still go on to seek medical advice, irrespective of the information shared to you today. So without further ado, we're going to go to Professor Rowland. And question, Professor Rowland, this is the third webinar of the series now. During the first webinar, we talked about childhood fever. The second webinar, we talked about coughs, colds, and wheezes. So could you remind us of the take-home points of those webinars?
So that's a pretty a large topic to cover in summary, because we covered the whole of respiratory disease and we covered the whole of kind of fever. So these are the probably about 30 to 40% of attendances to our emergency departments are made up of kind of breathing difficulty and fever, probably maybe a bit more. And I would argue that diarrhea and vomiting is probably a smaller proportion of the children who come to the emergency department, but are probably some of the things that seem to cause parents the most concern. So what I'd say would be that for any given child who comes to the ED with a parental concern of vomiting or diarrhea, the biggest thing, bar none, and I mentioned this in the respiratory thing, is being more concerned about the amount of vomit or the amount of diarrhea than they are actually about the child themselves. And there is a principle that I've tried to do across all of these series. So when I talked about fever, I talked about worry about how your child's behaving, not how high the temperature is. With the breathing difficulty, look at how much your child can do rather than being concerned that they've got a cough per se. And for diarrhea and vomiting, I suppose the thing is your child still at least taking some fluid and having wet nappies? And don't get concerned that they've had 2 or 3 vomits or that they've had diarrhea for a couple of days, because they're all normal symptoms of the illness. And from an emergency department perspective, and I'm sure Hannah will chip in from her perspective, is what we're looking at is your child themselves. And if your child looks happy and alert and is playing around, then the diarrhea or vomiting in some respects is essentially irrelevant.
That's great, Professor Rowland. So I think it was the principles that we were after and I think it was probably too much to get to all the information from the first two webinars. So thanks, Damien. So the principles are that we need to really be looking at how our child is overall, how they're behaving, amongst the other sort of bits and pieces Damien's just talked to us about now. So with respect to diarrhea and vomiting, parents can become really quite concerned. And from our own experiences, sometimes that concern is related to how old the child is. The older the child, from a parental perspective, the less the concern. The younger the child, the more the concern. And how do we sort of look at these symptoms from and differentiate the symptoms between a younger child and an older child?
So that's an important question. So there are some symptoms and signs that are common across our age group. So a vomit is a vomit, and diarrhea, i.e. loose poo, is loose poo regardless of your age. But when you are very small, and I'm talking the first couple of weeks of life up to a month, vomiting is almost a natural response for your ability to learn how to feed, so that a small breast or bottle fed baby is going to bring up a tiny amount of their milk after they feed, and that's natural because their tummies just aren't big enough to hold everything in. And we call that term, or the medical term for it, is positing. Parents often describe it as vomiting, but actually the dribble of stuff that you get out of your mouth when you're a baby is probably normal. And it's only when that you are actively projectile vomiting, so that's the vomit comes out of your mouth and manages to go above something to hit the wall, would you start considering that calling vomiting. And at a young age, actually what we're more interested in is the colour of the vomit. So a white kind of yellowy liquid is really normal, and no one's concerned about that. But if you're really little, the big thing we get concerned about is what's called a bilious vomiting, or it's a dark green, and I emphasize the dark green. It's like an avocado skin. That is a vomit that you shouldn't have as a baby, and that's one thing that actually is what we call a red flag, something to look out for. But actually other types of vomiting are just probably normal behavior when you're a young infant. As you get older, so when you're a toddler, vomiting is very normal when you're ill, sometimes with a fever, sometimes with a cough and a cold, and you may just suddenly be sitting there and you'll just vomit everywhere. And actually afterwards, the kid might start smiling again. These random impromptu vomits seem to characterize toddlers, and it's frequent vomiting. So when I talk about frequent vomiting, I'm meaning 5 or 6 and repetitive vomits. And the other type of vomiting that becomes important in toddler group is they're the group at risk of head injuries. And this causes problems for us sometimes, because you can have a gastroenteritis, so a tummy bug that makes you vomit, and have a head injury at the same time. But if you're vomiting a lot after a head injury, that is something that needs some medical attention. Finally, I suppose if we get into the older group, vomiting does become more unusual. And unless you've perhaps ingested a little too much alcohol the night before, it isn't something normally that the older children and vomiting do, or teenagers do, unless they are unwell. And if they are, what we like to see, and especially in the emergency department, is if your vomiting is normally associated with a bit of diarrhea when you've got a tummy bug. The vomiting often precedes the diarrhea, but if your child is vomiting a lot, and actually there doesn't seem to be much wrong with them, they've not had a fever, they've not had a kind of a cough or cold, that's something that draws my attention, because that's a bit more unusual. So I hope there's those 3 parts I've tried to play out.
Thanks. That's really useful to understand, actually. So you've got vomiting in younger children, which could be a normal part of growing up, and they don't even need to have an illness per se for a younger child to vomit. As you said, Professor Rowland, that this is positing. and the variations thereof according to the amount the child may be feeding at that moment in time. You've also talked to us about vomiting in older children, and most often if they have a tummy bug, it's associated with some diarrhea at the same time. But if there is only vomiting in an older child and otherwise well, and there's vomiting and not much else, then that might warrant some further medical sort of assessment. So that's vomiting, right? And then you've got the other side, you've got diarrhea. So what about diarrhea in really young children and older children? Just a similar framework to talk about diarrhea would be quite helpful for parents, I think.
Yeah, so diarrhea is an interesting phenomenon because it's not completely objective, and lots of parents get really worried about the poo in new babies. Unless poo has frank blood in it, so you can see blood and it's clearly red or stringy or there's clots, any poo is possible in any baby. So if it's yellow or green or brown, don't get concerned about the colour, because the baby's gut digests all sorts of things and it just turns out in all sorts of different ways. You can have loose poo when you're breastfed, or you can be very constipated when you're breastfed, and both really apply to bottle feeding. And so diarrhea, especially in the first couple of months, is quite there are very, very few things that mean that diarrhea is something serious. As you get older, diarrhea is often associated with a bit of a kind of tummy upset. And one of the challenges that we have, and we see this a lot, is parents get very concerned after a mild tummy bug-like illness, often associated with vomiting, that the child has diarrhea for quite a long period of time afterwards. And is there something wrong? And actually there isn't. What that's caused by is the inability to break down milk properly after you've had a tummy infection. The way your gut lining works after you've had a tummy infection, it breaks down, the enzymes don't work as well, and you can't digest milk, so you get quite prolonged diarrhea. So we often see parents very anxious, they have a well child, but the diarrhea has gone on for a long time, and it's almost always because they've had a gastroenteritis or a tummy bug, and that they just can't process milk for a while, and they drink a lot of milk under the age of 1, and so that will eventually go away. That's not concerning. And then as you get older, I think we've all experienced kind of rough tummies and had a bit of diarrhea, and that is just the normal process of coming into contact with different types of foods or different types of viruses. And I don't think there are any hard or fast absolutes. A bit of streaky blood sometimes happens after you've had protracted diarrhea, and it can sometimes happen if you get old enough to have constipation that causes you to have little tears. But I think any blood in the poo is something that you should seek advice for.
Thanks so much. And so we've talked about diarrhea and vomiting, main cause being a tummy bug. We've talked about how we differentiate that between younger children and older children, and the things that we look out for as doctors, and what we recommend our parents and guardians should be looking out for also. What symptoms are there in which we have to think about? Well, what symptoms are there where parents and guardians should be looking out for medical advice or seeking medical advice?
I mean, I don't know if it's worth kind of Hannah starting that off from a primary care perspective.
Fine. Yeah.
I think that there's a level of concern that will come much before you get to the emergency department.
Absolutely. So just go straight to Hannah. Thank you.
Thank you, Damien and Tarek. I suppose the first thing is I'd agree with Damien in that any child who's passing blood in their poo, that should prompt you to contact your GP for a conversation. And if your child is otherwise fairly well in themselves, that can usually wait for the next available GP appointment. But if your child is really quite poorly and you're worried about them, then I would say if your GP surgery is shut, it's important to phone 111 and to get some advice more urgently. I'd agree that in babies, really, it's hard to call anything diarrhea unless there's a lot of slime or blood in, because the babies naturally have very runny poo. But once your child has started to have normal poo, really a child that's having more than about 6 poos a day might be a concern, and probably we'd want to speak with you and just make sure they're taking in enough fluids, and get a bit of a report from you in terms of how that child is generally, whether they're really tired and not well in themselves, or if actually they're fine, they're just pooing a lot, and we can always offer some advice. And I think similarly is a sort of a cut-off mark for vomiting. If your child's vomiting more than 3 times a day, we'd probably want to speak with you as a GP surgery, just so we can talk about whether they're taking in fluids, and then whether they've got signs that they're not getting dehydrated, that they're getting enough fluid on board, so they're having regular wet nappies or they're having regular wheeze. We'd want to have a chat with you about that. I think the warning signs for me outside of those markers would be a child that's got a funny colour. You know, if they look a bit mottled, if they're feeling cold in their hands and feet despite being in a warm room, we'd want to definitely speak to a parent in that sort of situation so we can do a fuller assessment of that child. I think a child that's got diarrhea or vomiting and is quite drowsy with it in a way that's not usual for them, we'd want to speak to those parents, particularly if you're finding that they're sleeping but you're just really struggling to wake them, or they're dropping straight back off again, and that's outside their normal pattern of naps. I think the other thing to always look out for in a child with diarrhea or vomiting who seems unwell is to just check them all over every few hours for rashes. And most parents, I think, are familiar with the warning rash of possible meningitis, which is one that doesn't disappear when you press on it or when you press a glass on it. We call that a non-blanching rash. And if you just, trust your parental instinct, trust your instinct as their carer. And if you think they're just not right, then we'd want to hear from you and we can have a chat. And very often we can assess that child over the phone from the information that you give us as a parent or carer, or we can arrange a video call, or we can bring them down to the GP surgery. GPs are open, we're seeing patients face to face. And if your child needs to be seen, we will see them. And even if it's simply because you feel your child needs to be seen and you need that reassurance, we'll see your child.
That's great. That's a really useful piece of information about how we assess as doctors children and the symptoms parents and guardians need to look out for before they decide to come to see you. Now, just going back to basics, we've talked about some of the causes of diarrhea and vomiting. Are there any other causes of diarrhea and vomiting which are fairly common or not so common, Hannah?
Thanks, Tarek. I think a really key bit of information is how long it's been going on for. So when we talk about the common causes of diarrhea and vomiting, which are usually tummy bugs of one sort or another, it's normal for that to go on for 5 to 7 days. But certainly within about 10 days, you would expect your child to be back to normal. If there's a pattern of diarrhea or vomiting that actually continues for a lot longer, we're talking about really more than 2 weeks, even if that's a pattern of diarrhea and vomiting that comes and goes, but over a longer period of time, then it's really important to speak to your GP, because there are unusual causes and it would be pretty unusual for your child to be affected. But sometimes it can be a problem with being able to digest certain foods, or a bit of a food allergy or intolerance. Interestingly, children can sometimes develop constipation, but it shows itself with runny poo over a long period of time, because the big hard ball of poo blocks the gut and water seeps around it. So a child with watery diarrhea that's been going on and on might actually have constipation. And there's some really unusual illnesses which you might have heard of. There's something called celiac disease, which is a problem with being able to absorb anything with wheat in, and that will likely make a child generally a bit unwell. But you might see things sort of over the course of several weeks or months, like they might just have a pattern of being sick, which is a bit unusual for them, or their poo might be abnormal, or a bit of diarrhea. So I think a key thing is a child who's been unwell for more than 2 weeks. or with symptoms that keep coming back. I guess the other thing to look out for is a child who's losing weight, or in younger children if they're dropping behind on their development and not growing as you'd expect, and that should definitely prompt you to bring that child to their GP.
So I think Hannah might have cut off there just for a few moments. She talked about a child who's losing weight as a child who ought to go in for medical assessment. I think the key thing to remember, though, is that these causes are very rare. We don't actually see them often. And often parents and guardians will have good intuition as to when to bring the child in for medical advice. And so the vast majority of cases that we're all seeing as clinicians are very mild. They don't actually need medical advice. There are some symptoms that Dr. Robbins has talked about, which mean that we would like to discuss the symptoms over the phone with you. And there are markers that we will try and process over the phone to determine as to whether we need to bring you in for a fuller assessment. And so in that fuller assessment, Dr. Robbins, what is it that we're looking out for as GPs when we see a child face to face? And what markers are there that would then prompt us to escalate things and even send a child to hospital, albeit not that common, thankfully?
Thanks, Tarek. And I completely agree. I think the key message is in most cases, this is something mild and the child won't need any further medical input. But the things that might concern me a bit, the things I'll be looking for is firstly how that child is in themselves. Are they well? Are they lively? Or are they really, really not very well and quite sort of listless and floppy? I'll be looking to see whether there's signs of dehydration. So that's a child that's either not getting enough fluids in because they're vomiting, or they're losing a lot of fluids either through vomiting or diarrhea. So I'll look at things like whether their lips are moist, what their eyes look like, what their skin looks like, and whether their hands and feet are warm or whether they're cool. I'll be looking at their colour. I'll probably want to examine their tummy and see whether their tummy's sore when I press on it, or whether actually it doesn't bother them at all, because that can be a good sign as to whether or not there's anything going on. And I'll sort of have a bit of a benchmark in my head about what I would expect from a child of that age and whether I think their sort of height, weight, stage of development is where it should be. If I'm concerned about any of those things, then I would probably think about either getting on the phone to Damien or one of his team, or writing a letter to ask for some advice from the hospital specialist team in the Children's Hospital.
Thanks, Hannah. That just gives parents and guardians an understanding of what we're actually looking for when we're conducting our examinations, which could be quite useful for parents and guardians to know. So we've talked about those few children who need to go into hospital for further assessment. And it would be just very useful to touch on briefly what would happen once a child with those symptoms who has been deemed to go into ED goes to the emergency department, Damien. What goes on then?
Yeah, thank you. So I think a lot of our management, and let's just talk about simple gastroenteritis. Now, there are some other rarer conditions that might cause you to have diarrhea and vomiting, but simple gastroenteritis is very common in the UK, but it is very uncommon for you to require to need to be admitted to hospital. And I emphasize that point because a lot of what we do within primary care and the emergency department is to try and recognise those rarer cases that we might be missing something different, because it is highly unusual if you simply just got a tummy bug for you to become that dehydrated that you will need us to do something active to you other than just to suggest some simple fluids. And parents get really concerned because they see the vomiting and diarrhea, they see not a lot of fluid going in, and rightly they're anxious. But actually, especially if you're small, we have unfortunately become programmed to expect quite a lot of input into our children. And I think there may be parents and parents watching this who have been frustrated by the fussy eating of their toddler. Actually, the calories you need are a lot less that children get by, especially for short periods of time, with much less calories than you think they need. They don't need 2 Big Macs a day. They don't need 3 square meals. They need fluids, but they don't need a lot of substance. So there's a lot of anxiety created. My child's not eaten for a couple of days, or they're not drinking very well. Well, actually, it's quite rare to have so little that you're going to come to harm. And what we do in the emergency department is check the hydration and status of the child. And we do that by sometimes just waiting for your child to wee. And that's useful to us because a urine infection can sometimes be a rarer cause of vomiting. So that kills 2 birds with 1 stone. We'll wait to prove that you can pass urine, which means you're hydrated enough, and we can dip that urine to make sure that there's no bugs in it. We will often weigh your child, and that to me is the single biggest thing as a parent. As Hannah explained, you can have diarrhea and vomiting for some time. If you're losing weight and you've got vomiting, that's actually quite significant. However, loads of children have vomiting and a bit of diarrhea, and their weight's the same, or even they're gaining weight, which means that there isn't really anything serious going wrong. So we'll check our weight, we'll check the hydration status of your child, and we might observe for a period of time. But largely, we won't do anything other than that. We may give you something called, in Leicester we use Diarrhoea, but what should be referred as an oral rehydration solution. And that sounds really complex and medical, but it is literally fluid with sugar and salt in it. And there have been a couple of studies now that have proved that apple juice is just as good as any of these oral rehydration solutions that you can buy over the counter. Certainly, I wouldn't suggest, unless you're a chemist, making up just getting a bit of water and putting sugar and salt into, but that's what they do in Africa. They've trained parents to make up specialist solutions. But apple juice, or if you go to your pharmacy and just ask for some oral rehydration solution, they will give you packets that you can make up, and that's really good fluid to your child to take. Now, often the child doesn't take those fluids, and this is where in the emergency department we see this a lot. A child actively refusing, they'll spit out the fluid, they'll take the syringe and they'll throw it away. Okay, and if your child is well enough to actively go, I'm not taking any fluid, they're not that unwell, and they're not thirsty enough, and they just need to be thirstier, and they'll get there eventually. I become worried with the very listless child who is all over the place and it's the fluids dribbling out of their mouth. That's an unwell child. But we have lots of anxiety from families who are trying to give the fluid and the child won't take it. If your child is strong enough to say, I don't like this, then actually they're still pretty well. And so we'll observe that in the department, and then we'll probably send you home with some fluid to try and keep giving at home.
Thank you very much, both. So we've got a good idea as to the causes of diarrhea and vomiting. We've talked about the symptoms and how we look at those symptoms in younger children compared to older children. We've talked about the rarer causes of diarrhea and vomiting. We've talked about what we do as general practitioners to assess children for parents who are concerned. And we've talked about what happens if children have to go into hospital with diarrhea and vomiting. And thankfully, even in a hospital setting, it seems that most children will be safely discharged after a period of assessment. So that's really reassuring for parents and guardians to know that the vast majority of children are going to have diarrhea and vomiting. There's not much that you need to do beyond the advice that you've had through this webinar. I think it's always useful to go back and look at what resources parents have through primary care, through medical services, to access help when they need it in the right time and the right place. So I'm going to go to Dr. Robbins, and she may be able to tell us what other services there may be, apart from general practitioners, who they could go to for some advice.
Thanks, Derek. I think the first thing, if your child is not particularly unwell in themselves, is to speak to your community pharmacist. They're highly trained, they're trained to deal with childhood illnesses, and they will also be able to tell you if it's a situation where you need to be speaking to your GP surgery. So very often community pharmacist is first port of call. If you're thinking, I think my child probably does need to see someone, or I need to speak to a doctor or someone else at the GP surgery, then contact your GP surgery if it's during opening hours. NHS 111 should then be the first port of call for out of hours, but there's also a number of urgent care centres around Leicester City and Leicestershire and Rutland, and we've got a map of these up now, and there will usually be someone there that can assess your child. It's just worth looking on the CCG website to check whether you need an appointment first or whether you can just turn up. And then I think, you know, in a situation where you've got a child you're seriously unwell, they're not really responding, or they've got that nasty meningitis rash that doesn't go away when you press on it, that's a situation where you need to be calling an ambulance, or if you're very close to the emergency department, take your child in. But those sort of situations are pretty unusual. So usually it would be your pharmacy, your GP, 111, or one of the urgent care centres.
Thanks, Dr. Robbins. Really useful to know. So in the first webinar, we talked about fever in children. Second webinar, we talked about respiratory illness in children, cough, colds and wheezes. Today, we've spoken about diarrhea and vomiting in children. We're planning on actually continuing this series of webinars, but your feedback is really important in terms of what content you think would be important for yourself. We've got a range of ideas to think about for our next webinar in March. I would spread the word also that this resource is available via the YouTube channel. And if you could please drop us a message through social media or comment on the YouTube link, just to let us know how this webinar was for you, and whether you wish a particular topic to be presented next time. So thank you very much for taking the time to watch through this webinar. And thank you to Professor Rowland and Dr. Robbins to provide the expert medical advice that we've all had today as parents and guardians. So just a reminder that this is not individual medical advice, and if there are individual concerns about your child, then you need to seek advice from the right person at the right time. So there's much more information on our YouTube channel, so please have a look at that. We've also got a couple of websites which actually provide some really useful information about child health overall. There's www.healthforunder5s.co.uk. There's www.what-18.nhs.uk and www.111.nhs.uk. So thank you very much for taking the time to join us today. Thank you.